Hello, my name is Jeremy. I am a paramedic and current nursing student, and welcome to The Real Truth. Like, comment, and subscribe, and hit the notification bell. It really helps out with the channel. We have upload videos Wednesdays and Sundays, and let's go ahead and get started with the video. So I'm going to start off with a few myths and misconceptions about the health insurance. Okay, so let's go with myth number one. The first myth is the problem with health insurance is that sick people without insurance can't find affordable policies. Well, that's kind of like a no-brainer. Low wages, high income isn't gonna make sure that is available to anyone. So that one's kind of like a no-brainer. But in this article, it goes more into aspect of social insurance versus private insurance. So social insurance is pretty much your med game. Private insurance is what you can basically pay for, which is a PPO. It's like a provider organizational insurance that comes from like your business and stuff. So the better the bargain that you get from your company, the better the insurance will basically be. So in this article, it basically goes into how to provide care for the sick and poor. And then their quotes is pretty much for starters, it would help to understand that unregulated private health insurance markets are unlikely to deliver this goal. No insurer will be willing to charge a premium less than enrollees' likely health costs. So what that basically means is they're not going. So they're going to try if a procedure is pretty expensive, the insurance is not going to cover it, and especially if it's deemed that it's not really necessary. But if you're sick and your insurance can basically go for it and it's covered, they'll take care of it. So long story short, the insurance companies are used like a business, so any way that they can get out of not paying for it, they will. The advantages of these social insurance programs is that it is a national form of healthcare, which it can be a good thing and it could be a bad thing. It could just basically mean the overall cost is likely to be small, but the quality of it isn't going to be there as well. Myth number two: covering the uninsured pays for itself by reducing the expensive and inefficient emergency room care. So basically, it's in theory, it's saying that if the emergency room doesn't solve the problem, the person wouldn't get charged, which makes sense. If you come over there and you had a stomach pain and they just give you an IV bag and fluids, and then they just send you home, like they essentially didn't really do much of an issue. Now I understand if they need antibiotics or whatever and stuff, that does, but there's no reason why you should get like a $10,000 bill for just that. Antibiotics, especially from an emergency room perspective, they'll probably give you like an initial dose, probably like through an IM, but then they'll just send you home and get you a prescription to continue the antibiotics until the infection's over with, depending on how bad the infection is. If it's bad enough, you wouldn't just be in an emergency room, you would be admitted. So that's one aspect of it right there. But a lot of people in general go to the emergency room for the stupidest reasons, and it's some of it's for stupid reasons, some of it's because they simply don't have health care. So the emergency room is used like a clinic for them. So if you're able to educate the public and also have different aspects of community health to give them an option for it, you won't have an overrun of the emergency room, and you won't have a high charge of healthcare in that aspect. And the article also goes more into different aspects of preventative care and health costs. So preventative care, for the most part, speaks about keeping in good health, nutrition, staying physically active, which nowadays is starting to be more well known. Before, it wasn't really a factor to really know about and you just had to basically learn about it. But it's been more publicized with nutrition, staying active. So it has been getting better on that aspect. So money well spent. Okay, so America's one of the countries that just because you spend a lot of money on healthcare doesn't mean you receive good. With that being said, people tend to, in order to receive high standards of healthcare versus the norm, they go off of the location versus the amount that they pay. Because so you can essentially pay a high mark and still get shitty healthcare. It's just the way it is in our country. So myth number 3, lack of insurance is the principal barrier of getting high. Lack of insurance is the principal barrier to getting high quality care. Yes. It's you get. It's. I never thought I would say this, but in our country, with healthcare, you kind of get what you pay for. For example, if you're a chemo patient, you don't have the right insurance, or you don't have the right amount of money to pay for their treatments, which can cost hundreds of thousands of dollars, you're essentially left for dead. So it is what it is. The likelihood of getting high quality, like I said earlier, the likelihood of getting high quality care has to do with the geography than the insurance stands. I completely agree. There's a reason why a lot of people, if they go if an ambulance comes to their residence and they say like, hey, the closest facility is said hospital, and they're like, and they see like a bad experience, don't take me to that hospital, I don't want to go to that hospital. It makes sense to me. If they jacked off something or you heard like a couple of relatives pretty much died and stuff, I can understand how somebody basically like, no, I don't want to go to the hospital, and then the ratings go down. So employers can shoulder more burden of paying for insurance. Yeah, because depending on the position of like an employer, they offer better benefits package. So I'll give you an example. Like let's just say you have like a Domino's employee, right? A Domino's employee, regular employee, they have insurance, but they're not going to offer the best. But like if the person becomes like a GM or district manager or whatever, then the company is more willing to give you more quality insurance for you and your family. So it is a bargaining chip for companies to get better insurance and for a cheaper premium rates. And the way it is right now, it is the best healthcare is pretty much a private healthcare, or it's just how much you're willing to spend. And that's pretty much about it. Like high deductible healthcare plans and competition can lower the rates. It's just I do believe in that one. It says it's a reality, but I'll have to double check that because I believe there should be a cap. I'm not for the government really controlling anything with it, but pharmaceutical companies and health insurance has been taking advantage. So if it was an aspect of just having a cap to how much they can charge the American people, I would be more for that solution more than anything. But it is what it is, though. It's like the only good aspect when it comes to usually health insurance right now is what was in place by Obamacare, by not allowing insurances to reject people who have pre-existing conditions. The premiums is high and unaffordable to like your regular American. It's probably more affordable to a low income because it's a cheaper rate. But even Obama said that was like a start because he just needed to get it passed and then try to improve upon it. But it didn't really seem like that ever really happened. Alright, so those are the 5 myths of healthcare that I wanted to go into in regards to health insurances. If you find this information useful, hit the like button and hit the notification bell. Which one of these do you feel is more useful or more informative to you? Let me know. See you in the next video.